Hello, my elite seniors. Tell me honestly, how many times did you wake last night to use the bathroom once, twice, or more? If it's more than once, you're far from alone. Waking at night to urinate, we call it nocturia, is common as we grow older, but it's not something you simply must accept. With a few sensible habits and medical-minded checks, many people sleep longer and feel stronger by morning. Today, I'll share 5 simple, natural steps you can try, plus medical, evidence-based care tips so you know when to ask your doctor for extra help. You can improve nighttime urination, gentle habits, timing, and a few medical checks can make big, practical differences. Elite seniors, start with this. Small, steady changes win big, unreliable fixes. Try one change this week and build from there. 1. Move fluids earlier in the day. Sip small amounts all day to stay hydrated, but limit heavy drinking 2 to 3 hours before bed. Avoid caffeine, black or green tea, and alcohol in the evening. They stimulate the bladder and often cause more trips at night. 2. Elevate your legs in the evening if your feet swell. If you notice leg swelling after a day on your feet, resting with your legs up for 20 to 30 minutes before bed helps shift fluid back into the circulation earlier, which can reduce the amount of urine your body makes overnight. Compression stockings during the day also help some people. There is clinical evidence that leg fluid redistribution contributes to nocturia. 3. Practice gentle bladder training. When you feel the urge during the day, try waiting an extra 5 to 10 minutes before going. Slowly increase that delay. Use a short diary for 3 days. Note when you drink, when you void, and how strong the urge was. Avoiding diary is a simple, validated first step clinicians use to understand nocturia. 4. Strengthen the pelvic floor, the small muscles that support the bladder. Pelvic floor exercises, Kegels, are first-line, low-risk care for many older adults with leakage or urgency. Tighten as if stopping the flow of urine. Hold 3 to 5 seconds. Relax 3 to 5 seconds. Do 8 to 12 reps 3 times a day. Many trials and reviews show this helps reduce leaks and urgency over weeks to months. If you're unsure you're doing them right, a pelvic floor therapist or guided program helps. 5. Empty your bladder before bed and practice double voiding. Go to the toilet just before bed, even if you don't feel very urgent, and try waiting 60 seconds and going again to help empty fully. 5 extra practical medical care tips. Evidence-based. Check medicines and health conditions. Many common drugs, diuretics, some antidepressants, alpha blockers, and certain heart medicines can increase nighttime urine. Also check for diabetes, heart failure, or sleep apnea. These conditions change urine production and sleep. A clinician can review your medications and conditions. Distinguish the type of nocturia. Doctors separate causes into A. Global polyuria, too much urine all day. B. Nocturnal polyuria, too much at night. Or C. Reduced bladder capacity. Treatment depends on which is present, and the best way to tell is a simple frequency-volume chart, voiding diary. When behavior changes aren't enough, safe medicines exist, but know the trade-offs. Mirabegron is a modern medicine for urgency, overactive bladder that often has fewer cognitive side effects than older antimuscarinic drugs. It does carry blood pressure and urinary retention warnings, so your doctor will check these. Antimuscarinic drugs, older OAB pills, can help many people but have been linked in some studies to cognitive side effects over long-term use in older adults. This is why clinicians weigh risks carefully before prescribing. Look for infection or other red flags. If you have pain, fever, blood in the urine, sudden inability to urinate, or confusion, contact your clinician promptly. These are not normal aging signs. Consider prostate-focused foods and supplements cautiously. Pumpkin seed/pumpkin seed extract have some clinical studies suggesting modest benefit for men with urinary symptoms from prostate enlargement. They are food-based options rather than replacements for medical care. Talk to your provider before starting supplements. Simple day plan you can try this week. Morning, normal fluids and light activity. Midday, main hydration window, include cucumber/carrot salad if you like. Late afternoon, reduce salty snacks. Wear or plan compression socks if you have leg swelling. Evening, 1 to 3 hours before bed. Small, limited fluids. Elevate feet 20 to 30 minutes. Do calming breathing. Right before bed, double void once. A warm, practical nudge. Remember, this is a step-by-step journey, not a one-time fix. Try one habit for a week. Keep a small bladder diary. Try leg elevation for 3 evenings, or begin pelvic floor exercises. Most improvements show up over weeks. If you don't see change or if your symptoms are severe, your doctor can run simple tests, urinalysis, post-void residual, diabetes screen, and guide treatment safely. Disclaimer: this is educational information, not medical advice. Always talk with your healthcare provider before changing medicines, starting supplements, or making major lifestyle changes. Join our Health is Wealth family by subscribing. Together we'll explore practical, approved ways to sleep better and feel stronger. Click subscribe and share your results below. I read every comment. God bless and stay well.